All right, we are back. Health and Senate Health and Welfare, looking at H91 with Ledge Council. So, Katie, thank you. It's all yours. We're on page 25, I think.
Thank you. Here we go. Okay, when we left off, we were on section 9. This is a section that amends the language with regard to the designation of PAs. So this language would be added. Let me just read the whole sentence. I think that would be most helpful. Except as otherwise provided in this chapter, the commissioners of mental health endow, within the limits of funds designated by the General Assembly for this purpose, ensure that community services to persons with a mental condition or psychiatric disability and persons with a developmental disability throughout the state are provided through designated community health agencies, including community services to persons participating in VHARTH. This would include providing these community services that they're already providing to individuals participating in VHARTH when there's clinical need. The commissioner shall designate public or private nonprofit agencies to provide and arrange the provision of these services. So I'm not going to read through the rest of the existing language, but that is the where it would be located, what the change would be. That brings us to page 26, section 10. This is the chapter that I keep referring to in Title 3 that establishes the community action agencies and has the state oversight over their operation. There are no changes in here from the House version, so I may skip over it unless you want to go through it right now. No, okay.
Well, I'll ask the committee. So there are changes further on. Maybe just say what the section is about going like that.
Sure.
And then I guess we may be predicting other changes going forward. So,
okay. Most of the changes in this section are changing community service agency to community action agency. There was some also within this chapter, some sort of antiquated language from when the language was first adopted. Human Services decided to update some of that language. So those are most of the changes. There's also language that a community agency board would govern its own meetings and make its own appointments. Find that language. There's this cross-reference. I'm on page 29, lines 13 and 14. This is where there's language. The community services plan shall be completed every 3 years and updated annually. And then we cross-reference that in the VHARTH chapter, and it's also cross-referenced here that the plan shall include regional needs assessments required under 33 VSA 2211.
Okay.
And then, as I suggested, let's see what page is this. 30, bottom of page 30. There's language that each board shall adopt term limits and govern its members instead of being prescriptive about how many the length of time that members serve. So that is more of a substantive change, but otherwise it's more cleanup and trying to.
So I'm looking, I just want to go to the appropriations because we started talking about that yesterday with Nolan, and we will continue to do that. But what we'll be looking for from our cause organizations, what we'll be looking for is specificity to the use of the funds. And some of the funds, obviously, it's not going to be spent all between now and the 26 budget goes into place in July to July. I don't know how much of that money is going to be spent right away. So it's a matter of making a determination of what the funds are for. And then there's a section, I think, in the fiscal note that says and other things. So the phrase other things is a term of art that I haven't seen recently. So we're going to have to decide how these funds are utilized and ensure that there's some accountability for the use and how it's dispersed and when it's dispersed and who gets it, when, where, and how. So this whole section needs some work, but it will also, we need some help in making our decisions. There's a concern that we don't want to be investing $10 million in 2026, and then we come back in 27, we need more money. I do know the administration would not be thrilled with adding another 10 million next year, or the year after, or the year after. We're trying to reduce our dependence on the hotel motel program, knowing that that's a big chunk of money, that if we reduce it, there will be more funds available in the future for this work, but overall trying to bring ourselves within a place where we might have been pre-pandemic. So that's not something we can automatically do because of the need that's out there. So we're in a transition stage, all of which is to say, we need to look at the money and we need help looking at it with folks who are engaged in this work. That's the heads up. That will be a discussion, and we'll have joint fiscal in to help us go through that. And I'm sure the agency and the department will be looking at it. So there's a lot of collaborative work that has to happen before that's final. So, yeah.
Just been through, what are we on, 28 pages
Yeah.
of a wonderful plan, and it's written as if the decision has been made to do that. I don't feel I have the information to make that decision. We've got so many plans and reports and more plans and more assessments and more reports that it's going to take one to X number of employees just to write reports. And then we've got to do coordination, and we've got to do planning, and we have to pay for shelters and shelter setup. And we're told we're going to take that out of.
We're not. We're taking it out of this right here.
Well, no, this is a startup.
Yeah.
Okay, this is a transition. They're still going to need those employees to write all those reports. They're still going to need money to set up shelters.
Yeah.
I'm not clear how the shelter money is going to be distributed amongst the caps. Is it according to how much hotel motel was spent in your area the last X years? I think before we pull the lever, and maybe we have joint fiscal pulling the lever, or somebody, and you leave that.
Sorry. Making it.
I'm away. That we get that initial estimate. We've been told the state has money they can do away with a phone bank. And that money they can use to help run this program. All right. I haven't heard any of the money we're presently using. How much money are they spending on that phone bank? And is that going to be adequate to, because we're setting up 5 separate agencies. And I don't know, I don't have the numbers. This is it's what we do best. It is a magnificent plan.
Exactly.
I'm not sure if it's based on reality.
Yeah, this is when you get to this page, page 30,
Yeah.
page 31.
I think it should be page 1.
Yeah, well, we're gonna make it page 1, and
Okay.
we're gonna work with joint fiscal, but as you well know, it's how the money is distributed. First from the agency, or how is it distributed to the CAPS and then through community partners as a big concern. We've taken one of the concerns away with the HOP initially, but how those funds are utilized for what purpose? And, you know, do you have the workforce to do it or not? Is a lot of the work that's going on in the reporting piece already happening? I've heard that there's a lot already happening.
Well, yes.
But then we have $10 million more or less here to make things happen, but we want to know what it is. What does it mean to implement?
Well, it's, yes, before we decide that we're gonna spend 10 million to transition, I think we need to hear from the CAPS what they estimate it's going to cost them to
Exactly the
administer.
point.
And from the state as to what money, because there was some hesitancy, so I have a feeling some of that money just might be getting absorbed back into the budget of the agency. How much money are they willing to commit to provide the CAPS to do all of this wonderful stuff that they're doing?
So
And if they are doing
you're
something.
right on target, Senator Cummings. And so the question that I'm sending out to the CAPS as well as to the community organizations that would be in those regions is how will this money be used? Big question. I do know, I do know that having a little chunk in there for other things is concerning to me. And I don't think it's initially 1 point something million for each CAP. I think if I were a CAP, I'd love to get that, but I don't know that that is exactly what's needed. So we need to sort out what exactly is needed and then how is it appropriated and dispersed over time. So it may be needed over 2 years, might be needed in the first year. We don't know. We need that information. And that's why we have Nolan with us. He started talking about this the other day. I know the agency is concerned about how much money, the administration is very concerned about how much money, how it will be used. I think we all are. And I think that if I were a CAP, I'd be concerned too. What am I supposed to do with this?
Yeah.
But so sitting down and planning
Maybe
the
you
budget.
this big present that we haven't been able to do anything.
But so we need to have the budget planning process that comes back to us with an indication of how this money would be appropriated. So that's on those 2 pages. That's what's hitting us. I'm going to Nolan first and I'll come back to Senator.
All right.
For the record, Noel Langle, the joint fiscal office, there's a little bit of a chicken or the egg thing happening here.
Oh, good.
Because when I talked to the cabs, they said, what will you need? And I said, well, it depends on what it is you want us to do. But we don't know what it is we want them to do until they tell us what they can do. There's a bit of a
Yeah.
chicken or an egg, so there has to be some point where there's a conversation, or to your point, what would it look like with the other plan budget? I don't know when that happens, but in order for us to appropriate some money for it, well, for 27, you don't have to set now, but you still need to know how much you need, and they won't know how much they need until we tell them what to do, but we can't tell them what to do because we don't know how much they need.
So, and we're getting an idea of what was required by all the work that's is in the previous pages. So, I know that I would really hope that the cafeteria hallway group continues to meet. Honestly, and then every time, what I'm going to ask and what I've shared with Kiki is now we have a new draft here, but we also have money being appropriated for something that's going to happen. And my ask of the CAPS and others who are the community service organizations is when you come in to testify on the new draft as we go forward, I know the people wanting to testify right now, They were testifying on the old bill. Now we've got something newer to look at. Want to know how the money's going to be used and what your perception of that is, but it would be so much more helpful to have a group agree on what they see as the use of that money. And Senator Gulick is itching to say
Well,
something.
it just seems as though that report that we're gonna get in October, the report we're gonna get in January, and the needs assessment, those, you're right, we're kind of in the dark until that work gets done.
Yeah, you're right.
Then once that happens, we should have a better sense of where the needs are and how money needs to be allocated.
Yeah,
Amongst that needs could be the administrative cost for the agencies.
yeah.
And we could also ask the state to report back at the same time how much money is presently being spent. Because that's
That's what
based
they're
on the
doing.
budget.
Yeah.
How much they are anticipating being able to save administratively so what will they guarantee to give the caps?
Mhm.
And it would be even more helpful if we could get those numbers from the agency now,
Mhm.
so that the caps could tell us,
Mhm.
you take that amount, you divide it by 5, and this is what we could okay. This is what we could do
Mhm.
with this amount of administrative money.
Mhm.
And this is what it would cost us to administer the full boat of things you're asking.
Right, and it will be a transition in there. So, but when you were talking earlier about how many, it could be limited service positions, there could be some short-term positions at the local level for the initial planning, but there will be positions that are needed to make this happen. So those are questions I'm looking at Nellie over there and hoping that you're getting this request to the agency. That would be great. So we need to have that, and that will help the caps as well. So it needs to be a conversation that happens. But it can happen in here. I'm happy to have that happen in here while we look at 91. It can also be the hallway conversation, the cafeteria conversation that's really very
I
helpful.
mean, this right now is asking an awful lot from the caps.
Yeah.
There is absolutely nothing about what the state will provide
Mhm.
other than an initial $10 million if that survives in the budget.
It's in the budget now, but
It's in the budget.
it needs to be clarified in the bill.
But
I mean, it's just
Ongoing,
waiting.
what are we going to provide them
yeah,
in the way of funding? In the way of administrative support?
yeah,
I'm just concerned that having 5 centers of administration is going to take money out of the money that we've been presently using to support homeless people.
well,
And that will end up
you're right.
not helping
Yeah.
as many people because we're using more in administration.
We don't want to be setting up the Department of Bureaucracy across the state. We don't want to see another layer of bureaucracy.
We don't want to set
No
anyone
question. But there is some greater efficiency to be gained with having local decision making. So it's that balance between the two. Can you keep the administrative cost at a level that's affordable? And will the administration also have some oversight in how it's used? And how will this initial funding be distributed to get things up and running? And then what do we need next step? All of those things are here, and it's a big decision for us. This is a lot of work for us that we are going to have to do. I'd say it's, yeah, a lot. I mean, we were just handed the money. We don't know how it's being used. I know it says lines.
Well,
And
I mean,
that's
there's a
the one-
1-year commitment. There's no ongoing commitment.
Right, but we don't know if this is what 1 year needs. We don't know
we
if
don't.
this is, a half a year, 2 months, 2 years, but we need to see that. I'm looking at Nolan and knowing that we're gonna have a lot of work to do for this. And I'm looking at everybody in the room. We're not, this isn't mean that we're trying to underfund you. What it means is we need to be very specific about the funding so we get what we want when we want it, right? And what we need.
So
Can I just ask you a clarifying question?
Can you, state your name for the record?
Yes, Amy Schollenberger for BCAP. I just want to ask a clarifying question because I'm hearing two different requests and I want to make sure we're working on what you actually want. I think what's possible to work on is what is now the $10 million appropriation in the bill for the transition planning portion. I think what Senator Gulick said is accurate because we don't even know yet how DCF is and the CAPs are going to agree to distribute the funding, and the
Right.
amount of funding that each region gets will partially determine how much administrative costs there are for each CAP.
Right.
And so I think we're ready to talk about that transition period. And we're talking with DCF to see if we can agree on whether our numbers are, acceptable to them. So that's the part we could talk about next week, but I don't think we can talk about year 2 and year 3 yet.
No one's asking you to do that. I think,
Just wanted to make sure I
I think Senator Gulick had a very legitimate concern. If we start putting $10 million in this year and that's the whole ball of wax, then is that what's gonna be ongoing? That's a big chunk. That's a lot of money. So we're gonna have, that's over $1 million individually, for each cap. That's a lot, and it's, for me, too much. So I'm just sharing with you my appropriations fact.
I mean, there's startup and there's
Right,
things, and 10 million may well be too much.
yeah.
But there is going to be an ongoing administrative cost to
We'll,
these
and we'll have
agencies.
to figure that out.
If it does come to $10 million or 5 million or 8 million, we need to know that because that is an ongoing cost commitment that we're making. They don't have other sources other than federal grants, which we get.
So, yeah,
very-
so all of this is one-time funding. We don't know what the ongoing operational expenses will be.
You could do- keep the 10 million in the budget. I don't think each agency needs the same amount because they're different, Chittenden
Yeah.
gonna need a little more than Franklin or.
Yeah,
Right, so I think that, you have 10 million, then you require each cap to provide, 26 budget and a 27 proposed.
mhm.
So what happens in each, so that 26 is okay, and then they'll contract for the 26 based on their determined need,
Mhm.
and they'll be negotiated. And then what the 27 proposal does is it gives the DCF something to come into for their 27 budget.
Got
Say,
it.
okay, we've talked to each cap, this is what they need. And they can refine it as long as they get it done before January, right?
Yeah.
Or December, whenever the budget instructions are. And by the way, that's what budget adjustments for. If we find, guess what, we didn't need the whole 10 million, that money can be reinvested. Or if they needed more, but whatever. So maybe that's what you do is you keep the 10 million appropriation as is, and you require each cap to provide a 26 and a 27 proposed to DCF
So it's really the 6.5 that we're talking about, and then,
or whatever.
and then DCF has the 500 and the 3 million for shelter
Correct, yeah.
capacity.
And then let them, so you might find one cap doesn't need 1 million, another one needs 1.2,
Right.
depends on what their need is. And DCF, when they contract and decide, no, you don't need that much or even more.
So thank you for that. That's good clarity. So the clarity is bring us a budget.
Yeah,
There it is. We need to see it.
that way you're not asking Amy to give us documentation tomorrow she can't do.
Okay, forget the 10 million. Let's think about the 6.5.
So,
Don't even think about that. Just think about the budget. Don't even think about what's there because it's, who knows? Okay. Thank you.
I know you're talking more big picture right now, but I just wanted to bring us back to the regional assessment plans. You're getting 2 of them from the CAPS. You're getting one this coming January, one in April. And right now, the language says including fiscal year 2027 budget needs and estimated administrative costs. This might be the wrong timing. This might be the wrong question of the specific things you need, but I just wanted to flag for you that you do request budget and administrative cost information in January.
For the next year. So if the more,
Yeah,
the sooner
fiscal
we
year
get,
27.
the sooner we get the information, the more likely it is to be included in a budget proposal through the administration.
You can do two, you can have the 26 by such and such date, July 1, CAPS shall provide DCF with a proposed budget, and by October to provide as a 27 budget. They'll have some integrations.
So this is an issue that we have to resolve. Can you get that language to Katie that you just?
Can we talk about that timing though?
Yeah, no, we need to.
I'm just throwing the dates out.
No, I know.
So you're thinking that by this January 1, 25, you want fiscal year 27 budget from the CAPS?
They'll need it.
We have
On
to have
January
it.
1 of 25.
So they'll need, so for the 26 budget, what we're gonna give them the 26 fiscal year. We'll need to know, if you wanna accelerate it for the 10 to 6.5
Need it
million,
now.
we'll need that pretty quick. But in order for us to know what the budget, the 27 budget. DCF will need to know probably by November, because that's when their budget
Okay.
instructions go
So the
out.
fiscal year 27 budget, but what is coming back on January 1, 25?
That was 26.
26.
Yes, thank you.
So
So
they'll-
the
It's
July,
getting confusing. I
No,
know
we're-
so July 1, 25, what?
would be that what their need is of the appropriation that we're doing for this year.
Okay,
10
so the
million
10 million.
Or the 6.5 or whatever.
6.5.
So 7,125,
And the agency will have to tell us what they're doing.
you need a budget,
Yes, it will need that from the agency.
you need budget for the 10 million.
And then I would say by like October 15th, because budget instructions for DCF and the agencies go out, when they go out, October, November.
Yeah, the governor's making the budget up.
Cause by January, like, it's already done, but December, it's already done.
Half year fiscal 27 budget inclusive of admin costs.
This is a heavy lift.
I don't think you need to say it's inclusive, it's just kind of, I guess, like, what are their needs, you know, like,
Okay, and
what
then
their
we'll
budget is.
pull it out of these regional plans that are coming back in January, correct?
Right, and it's really the 6.5 that goes to DCF for the statewide organization. And the statewide, we don't have a statewide organization. We have CAPS.
It's the network.
Oh, the network, you're right, thanks. You had a comment or question?
Yeah, thank you. For the record, Lily Sojourner with the Department of Children and Families Office of Economic Opportunity. I do wonder if there's a way to slightly stagger them with the plan timeline, because again, just being mindful of like, what is the intent? What do they have to do? And then what's a budget? And so I don't know if it potentially makes sense to say if we have a plan due by this, like a month later, the associated budget is due to allow
Sure, I mean, this is something that
for consideration.
crowd.
The
could-
cafeteria
yeah,
crowd.
sit down and, you know the reality, tell us what's a realistic.
Well, there's also all the time that gets lost in contract.
What is your, let's get into Amy, go ahead, for the record.
Amy Schalberger, VTAP. I just want to caution the committee on how you're saying this, because if the regional groups get to make a plan and build a budget for the plan they want, it's going to be more than what you're currently budgeting for these programs,
Of course.
because they already know they're underfunded. And I think what the CAPS have been saying is, it seems like they need to know how much money is available and then build a plan from that number. And so, because otherwise, I mean, they're happy to build you a budget, but if you just say no, then they're gonna have to go back to the regional groups and say, we didn't get funded for what we asked for. And so I think it's just important to think about when you're saying you want to spend less money every year or in this.
I'm talking about, that, and I don't want to spend less money here.
Right,
I want to see the hotel motel $30 million decrease. It's nothing to do with VMAR.
okay, I understand that, but knowing how much money each region has in order to make a plan for that money, I think makes more sense based on the budgeting climate.
Okay, so right now in the bill.
Yeah.
There is $6.5 million for 5 regions and the network.
Yes,
All right, so that's the money we're talking
yeah,
about.
we can do that.
Build the budget. Tell us how it will be used. For what purposes. There may be things that are not currently available to you that will add into that. So we're not saying bring us more.
I
than
was
that.
responding to the reporting that you were just talking about for FY 27.
Okay, well, that's a different story.
Yes,
So
that's
right
what I
now
was.
we're here. And so then the next step is building a budget for 27, because guess what? That happens pretty quickly. No, so if we're gonna make this happen, we're gonna have to make it happen. I know it's a lot of work. But some of that work will be covered within the budget here for transition purposes. And once you get a plan going and a budget plan going, then it gets a little easier over time.
We're not minding the work. I think it's just important to clarify who gets to determine the number that is coming to you as the total proposed budget for the program. Is it the administration or is it the caps?
Well, it is going to be a collaborative process and the ultimate decision is right here. So it's in the budget right now. There's $6.5 million. We need to know how the justification for that amount. We don't know. And we hear you, that there's some underfunding out there, but it's also what the administration now is using for funding for programs and how that funding will change, if at all. So there's a lot mixed in here. I can't answer your question. It's the information that you folks have to bring to us. It's the information that the agency has to bring to us. And the reality here is it needs to be realistic going forward. Otherwise, the bill will die. And it won't die here. It might die somewhere else. Oh, I'm just saying, we gotta do the work.
Start with the 30 million we're presently spending.
30 million is on the GA.
Yes.
30 million for homes.
Okay.
I might recommend
Oh, good.
that we are less prescriptive. I'm thinking about what Lily said.
Okay.
Maybe we don't have a timeline for when they have to have stuff by. Why don't we leave it up to DCF and the caps to negotiate into contracts? And in that contract, they'll have all their timelines. They'll know what the needs are. And let's not be so prescriptive. Let's just say to them, get done. And then let them figure out the timelines and what the
Oh,
plan,
that'll be fun.
right? I mean,
Yeah, sure, we'll do that.
and then we're
Can
not
you do
getting,
that?
and then also for 27, again, we're not saying just split us 30. Like,
No,
it's
I
gonna
don't,
be.
we don't want to do.
And again, we're gonna leave it to DCF and the governor's budget to determine, and then the legislature weighs into the budget process.
Okay, can we do that? Can you
As
guys?
long as
got
they
it?
have, as long as they can opt out. Because if they do all this work in the governor's budget, we go through this next year.
Mhm.
And guess what? There's only half that amount of money available.
Well, yeah, then they can.
Then they can opt out. Or I just got a thing that AmeriCorps been canceled. There's no.
I know, our SVP is gone.
These are all the same groups of
I know.
organizations. That we may find out the CAPS base money has gone away.
Mhm.
And they are in a very different financial position in 6 months, 3 months. So I think we could do initial planning now. But
So I'm with Nolan's suggestion
Yeah.
here, and I'm looking at Lily and I'm looking at Amy, and I think you guys are probably gonna be helping us with this, with language and recommendations. Because look, it's important two places. It's important here, and any recommendation that we make here goes into the budget conference process. We might make sure we get it right.
I think, yeah, I think that, you know, again, that's where the goals, intention, services, and the what is due in these reports becomes very important, because then it allows us to have a common touchstone for a reasonable then allocation. Which again, we may not always agree on, but as opposed to being more hypothetical. So I think having that scope would then allow for that planning process to take place.
Okay. All right, we'll come back to that tomorrow. No. Next week. Huh? Does anybody want to come back to it tomorrow? Yes, ma'am.
For the record, Beverly Bogat, Vermont Early Childhood Advocacy Alliance. Just one seed at one plans is that part of this planning process will be talking about how the intake gets done for
Yes.
this program and how complicated that intake will be, what that will look like. And there is a line in there that talks about possibly expanding 211 to take on some of that intake. And I just want to recognize that right now, 211 is the emergency backup for both the call center and ESD. We're taking the intake calls for emergency housing. They cover them in the evenings and on holidays and the weekends. So the call center, the calls roll over to from ESD only roll over during business hours when ESD can't answer the phone. So while there may be some money in that call center contract, we may need to think about how that goes to funding to an expanded 211 or wherever that
Well,
intake.
we've got 211 expanded to 24/7 in the budget.
Yes, and this would be a whole different big chunk of work. So
So.
it's a conversation and I just want to plant that seed.
Yes.
Okay, well, that's
Go
helpful.
back
Thank you.
12-hour hold times.
Yeah,
And we're there.
no, we don't need that. Okay, so that's part of it. Good point. Good point. Okay.
Yes, please.
Okay. In section 12, you have future appropriations, legislative intent. So there's language, this has been tiered into two pieces to reflect the fact that hot money isn't part of the program until fiscal year 28. And then there's a new section of transition language on page 32 that is part of the fiscal year 28 budget presentation. DCF is to present a plan for transitioning HOP funding and duties to VRF. Maybe that can be expanded upon, but that's at least a placeholder for now that you need to have a transition plan in place.
It's intense. May not. Can't find future legislation.
This isn't intent like, I mean, this report isn't transition language. The intent to move the money is
Right.
transition, but the report is not. And then, as we've already talked about, we have tier effective dates.
Thank you. So the whole intake piece, assessment piece that Beverly was talking about. It's a big deal. It's important. I looked for some recommendations from the agency and DCF working together on that. That's outside of our, above our pay grade, but important. So committee, that's where the bill is now, and I think we've identified some places for consideration. I am looking at folks who are in the room. I'm looking at Amy and everybody. To help us get through, make recommendations that'll take us from the big picture to the actual steps on the ground. That's what we want to do. It's great to have philosophical development and discussion, but we need to have what we're doing next.